Bismillahirrahmanirrahim. In this video, I'm going to perform the upper limb tension test for the median nerve. This test is specific for provocation of symptoms in the median nerve, and the median nerve is most commonly involved in patients having cervical spondylosis, in cervical radiculopathy, as well as in the carpal tunnel syndrome and cubital tunnel syndrome. And this test is very often positive in a lot of patients who have upper limb symptoms as well as symptoms from the cervical or upper thoracic spine. So first of all, you need to place the pillow between yourself and your subject. This test can be performed into the supine position while I am performing this in the sitting position. The first thing is you need to ask your patient to relax the shoulder. This is the first step, or you can press a bit down. Then you need to take the tested side, which is in our case right side. You need to bring the arm into abduction 90 degree and then elbow extension, and you need to extend the wrists and fingers like this, and you need to perform a bit of abduction horizontally and extension at the same time, and then you need to turn the patient's head to the opposite side. You can also place your upper extremity onto the patient's shoulder and then extend, and this test can be performed. If there are radicular symptoms from all the way from the cervical spine to the wrist or hand, this test is positive. But because I mentioned earlier that there are different sites, for example, the median nerve can be compressed at the root levels in the cervical spine, in the cubital fossa, or in the carpal tunnel. So you need to look for what is the site of tension. Normally, if you are going to perform this test, if the patient feels tension in the cervical spine and hand on both sides equally, then this test is normal. A bit of tension or a bit of stretch is normal. But if there is pain or if there is paresthesia, that means the tingling sensation or abnormal sensation, pins and needle sensation, then this test is positive. This is very important to remember, that you have to perform this test in the patients who have symptoms from the cervical spine as well as from the upper thoracic spine. This test is not only a test, but it's also a therapeutic maneuver. So you can perform this or repeat this movement multiple times to make your patients feel better if they are suffering from median nerve radiculopathy. I hope you like this video. Thank you very much.